Today we live in the era of precision medicine, the precise selection of drugs in accordance with the unique genetic characteristics of each patient's tumor. Using modern molecular biology methods, individual metabolic pathways used by the tumor are studied and target structures are identified that can be blocked by suitable drugs. In other words, we find the tumor's weak spot. As part of individualized therapy, specific target structures are blocked, for example, receptors, nodal points in the tumor signaling system. These receptors consist of complex proteins that can be blocked with a suitable drug. However, simply identifying receptors and blocking them does not solve the problem completely. Tumors behave like living organisms that build their own communication and energy networks, responding to both internal and external influences. Many anti-tumor drugs can cause the activation of defense mechanisms in surviving tumor cells, which leads to resistance. For example, a drug is thrown out of a tumor cell or the cell uses alternative metabolic pathways against which the drug is ineffective. Malignant tumors begin to release their cells into the blood at an early stage of their development. By settling in other parts of the body, these cells form metastases. Anyone can donate blood for a preventive test that detects circulating tumor cells at a stage when traditional imaging methods cannot yet detect the disease. Isolating such cells from the blood is a difficult task. 1 milliliter of blood contains millions of cells, among which there may be only one or a few tumor cells. Tumor cells differ from healthy cells in other genetic characteristics, which is reflected in altered receptors on their surface. Antibodies recognize these structures. First, antibodies are bound to magnetic particles in the laboratory and added to a blood sample. The antibodies catch the tumor cells, which can then be extracted using a magnetic device. To make sure that these are indeed tumor cells and not healthy ones, marker genes typical of tumors are identified. The genetic information of these cells is then used to formulate therapy proposals. The test analyzes more than 80 genes, focusing on those that control tumor growth. Depending on the stage of the disease, individual therapeutic approaches are selected that are most effective and have minimal side effects for a particular patient. The patient receives clear recommendations on which drugs, including chemotherapy, targeted drugs, immunotherapy drugs, and even natural substances, are able to effectively fight the disease and which are not. The test results are presented in the form of a detailed and easy-to-understand report. The test can be used both for preventive purposes and in the process of treating an already identified disease. It allows you to track metabolic changes that indicate a relapse. This helps to adjust therapy in a timely manner. To perform the test, approximately 40 milliliters of blood is taken from a vein. For prostate, kidney, or bladder cancer, 200 milliliters of urine is also required. If necessary, cerebrospinal fluid or ascites fluid may be tested. The test can also be performed using tumor tissue obtained by biopsy and fixed in a paraffin block. A period of 10 to 14 days should elapse between the blood draw and the last chemotherapy session or surgery to avoid skewed results. Because some medications can affect gene expression, it is important for patients to list all medications they are taking.